Personalized medicine in type 2 diabetes. There also, as you know, there is a real epidemic of diabetes, especially of type 2. And although there we have drugs which are efficient, we know that they have their limitations. And moreover, we know that one drug will not fit the needs of every patient. We need to understand much more the mechanism behind in order to stratify patient population suffering from diabetes and in order to tailor the treatments according to the needs of the different patient groups or subgroups. That's the goal of this topic, in which there is also a basic aspect, but also what we are looking for there is team with experience in clinical trials, because there will be a clinical component in this topic. Preclinical models for tuberculosis. This gives me the opportunity to tell you a few words about the global dimension of IMI. So far, I insist on the fact, and that's the reality, we are focused on Europe. We want to improve the situation in Europe. However, you understand that our overall goal or ambition is more global. And this is especially true for tuberculosis. As you know, there are worldwide a number of initiatives, including public-private partnership, tackling the issue of development of new drugs for tuberculosis. For example, the Tuberculosis Alliance, just to give you one example. However, it was realized that there was a gap that could be filled in Europe. And the gap is to develop preclinical models using both in vitro and in vivo approach, which would be important to test new drugs and perhaps importantly, new drugs combinations. Finally, the last topic is a topic which is of key importance for all stakeholders. I think that we all realize that the way information is provided to patients about the drugs they need, about the way these drugs were developed, about the hurdles in drug development, and there are some hurdles that you cannot avoid, the way this information is given to patients must be improved. And indeed, patients want to be more and more active player in the healthcare sector, and for this, we have to provide them with the right information. And it's important that patients themselves are indeed involved in these efforts so that we try to escape from, I would say, a paternalistic approach to an approach where the patients are indeed actors in defining their needs, which at the end is obviously important for the patient, but obviously also for industry, which are developing products for those patients' population. And I can tell you that for this particular topic, there is a huge interest from the industry, from companies. I think that as of today, I understand that there are, I think, 11 companies, and every week I learn that additional companies would like to join. So I think we have there a unique opportunity to really build a new way to communicate between patient, industry, and also other stakeholders, and we are really looking very much forward. For this particular topic, not only companies agree to work together, to commit resources together, but they also agree that preferably this project should not be coordinated by industry. So there is, I think, again there, a unique opportunity to develop a new way to communicate information to patients. So you will certainly have questions about how to prepare the best project possible. A few indications. We expect project for 5 years, the final project. I will not give indication on the budget for each project. We have indication on the global budget. What I would like to indicate is that what we want is efficient consortium. So don't start by looking at the budget and then decide of the number of partners. Start by looking at what we are looking for and try to see the type of expertise you need. Don't increase the size of the consortium because you hear that there is a large budget. We would like to have the right partners with the sufficient means to develop the work, and that should be the starting point, at least at the level of expression of interest, and we will refine the discussion about budget when it will come to the development of the full project proposal. However, during the workshop, obviously the moderator or scientific officers will give you more precise indication about these financial issues. I mentioned the importance of the size of the consortium. Really, it's very important to have the right size, and we are not looking for too large consortium. Be very careful on this. We will ask our evaluator to carefully look at the management of the consortium, and we will ask specifically the question, is the size compatible with sound management? Any clarification regarding the process you will find first in a summary which is presented in the documents where the calls are detailed. This is the first pages of this document. And you have also more formal legal documents accessible on the website. I will let Magali comment about the IP approach. And I will end by mentioning that we developed in our office with the help of our IT manager, Philippe Lamotte, a partner search tool which will be accessible as of today or tomorrow, and there will be demonstration of this partnering tool during lunchtime. Timelines for this presentation, I will insist on the fact that we will wait for the expression of interest by the 18th of January, and the preparation of the full project proposal with the FPI companies after selection of the best consortium will start early or mid-March at the latest. Obviously, all potential participants are not here with us today, and that's the reason our external relation manager, together with our scientific officer, organize a series of webinars where there will be, again, presentation of the topics, and these will be interactive webinars where potential participants will have the opportunity to ask precise questions regarding the topics. This is the partner search tool that you will find by accessing our website. And if you have any further question, again, there will be a booth during the lunchtime where all these issues that we discuss will be, you will have opportunities to discuss them further. There is a USB key with a number of documents, and also there is the website with key informations. I will stop here. Thank you for attention, and I'm ready to take any questions. Thank you for attention.